I'm Heidi Spleet. I'm here with Dr. Tuliki Soka to talk about a plan to use cell phones to help monitor RA patients. What prompted you to develop the cell phone monitoring technology?
We know that in early rheumatoid arthritis, you need to put patient into remission very fast. And there are three key elements how we put patient into remission. First, you need to prescribe very powerful drugs to the patient, and then the other very important thing is that you tell the patient what is rheumatoid arthritis and why to take these drugs. The third key element is the monitoring. There are studies that show that frequent monitoring of the patients improve outcomes. And the traditional way to monitor the patients is to bring the patients again to the clinic and look at their joints and take lab tests and everything. Now, the problem is that not all clinics have the resources to have the patients very frequently in the clinic. Some recommendations suggest that patients come to the clinic if they have active disease even once every month. And then the other thing is that patients, for many reasons, may not want to come to the clinic very often. There may be long distances to drive to the clinic, or there may be no public transportation, or public transportation is very difficult. Or like in Finland, almost half of the year we have snow and ice on the roads, so you don't want to go to the clinic all the time. So let's use the cell phone technology and keep it very simple so that there are no difficulties to have the monitoring through the cell phone. So we developed this system with only 3 questions during these 6 months, which is the period when we use this cell phone monitoring in patients with early rheumatoid arthritis. So the patients get the diagnosis and we register him to the program. 2 weeks later, the patient gets the first question, and the question is, did you start the medications you were prescribed? And the next question comes 2 weeks later. Do you have any problems with the medications? And the third question comes at week 6, asking how do you assess rheumatoid arthritis severity on the scale from 0 to 10. And it's only one keystroke in your cell phone, you give the answer. So we wanted to keep it very simple program.
And so how are patients responding to this so far? Do they like it?
I think that like all patients who you explain this program carefully and you explain why we want to monitor you over the first 6 months. At least my experience is that everybody wanted to be part of that program. Of course, there are some people who are not using cell phones at all. Of course, those then cannot be part of this program, but almost everybody has.
So what are your plans for the future? Do you plan to continue using this?
At the moment, we are using this in 14 clinics in Finland and possibly still getting to all other clinics in Finland, which we are planning. But I think that this would be a concept to think about to many other clinics around the world using same kind of system to monitor their patients and to improve patient confidence and to improve patient adherence to the treatments and get them feeling safe and confident.
Thank you very much.